Hello, ma'am. हेलो मैम. हेलो मैडम, आवाज़ नहीं आ रही है.
Overall processes would lead to the synthesis of VLDL. Okay. So
मैडम
this,
आवाज़ नहीं आ रही थी.
oh, so why you did not tell this earlier?
मैडम आई पता मैडम.
Chiranjeev, at least you should tell earlier that avaz is not, sound is not proper. Okay, I forgot to unmute my mic. Okay, thank you for
यस
asking.
मैडम.
Uh, so let me quickly again finish it. All the process actually took place simultaneously. Okay. The protein part, ApoB100, ApoC, and ApoE is synthesized through rough endoplasmic translation process. Okay. And this ApoB100 can be catabolized and give further amino acids or protein also, or these ApoB100, ApoC, and ApoE can be utilized for the synthesis of VLDL. And from bottom of this slide, you can see insulin can positively influence the process of lipogenesis, and glucagon divert this acetyl coenzyme A, which is generated through the process of lipogenesis for further oxidation. Okay. And this acetyl coenzyme A, under the influence of insulin, converted into 1,2-diacyl glycerol, and this 1,2-diacyl glycerol converted into triacyl glycerol, and they also involve in the formation of phospholipids. Okay, so choline get coupled with the phosphate group and CDP group and form and helps in the synthesis of phospholipid. We earlier we were see this whole process of synthesis of phospholipid in our yesterday's class, so I'm not going to repeat it. These all triacylglycerol phospholipids and ApoB, C, and E, they involve in the synthesis of VLDL, along with when cholesterol and cholesterol ester, they also mixed. They also involve in this process, and where this process actually happens, this process happens inside the smooth endoplasmic reticulum, and from smooth endoplasmic reticulum all the component get assembled and transported to Golgi, and Golgi transported to from liver hepatocytes to blood via vesicle mediated transportation. So this is the overall process of synthesis of VLDL and other lipoproteins, and also the transportation from also their transportation from liver hepatocytes to blood. I explained it earlier, but just quickly remind you once again, what are the lipotropic agents? Lipotropic agents are the molecules which positively influence the lipogenesis process. For example, choline, inositol, methionine, and some essential amino acids, essential fatty acids, antioxidants, vitamins, vitamin B12, folic acid, and certain synthetic antioxidants. They basically helps in the removal of fats from the liver cells and thus prevents the formation of fatty liver, and they are thus called as the lipotropic agents. What they do, these all factors helps in the removal of fats from the liver cells. So basically there is a disorder associated with the plasma lipoprotein metabolism, and this is known as the dyslipoproteinemias. It is an inherited disorder where defects in lipoprotein metabolism lead to the primary condition of either hypo or hypolipoproteinemia. hypolipoproteinemia. Hypolipoproteinemia means there is a deficiency of lipoproteins in the hyper means there is an excess of lipoprotein in the blood, or hypo means there is a deficiency of lipoprotein in the blood. In addition to this disease, certain other conditions like diabetes mellitus, hypothyroidism, nephrotic syndrome, and atherosclerosis are also associated with secondary abnormal lipoprotein patterns that are very similar to one or another of the primary inherited condition. All of the primary conditions are due to a defect at a stage in lipoprotein formation, transport, or degradation. So basically, primary dyslipopproteinemia actually involves hypolipoproteinemias, which can further categorized into a beta lipoproteinemias. Basically, here defective chylomicrons or absence of chylomicrons have been seen. And VLDR or LDL, defective VLDR or LDL are formed, which basically actually their ApoB part is not proper. And this is the rare disorder. Here blood acylglycerols is low, intestine and liver accumulates and accumulates excess of acylglycerols, and intestinal malabsorptions happens. Basically, familial alpha lipoprotein deficiency, where all or low or near absence of HDL is near absence of HDL have been seen. So what happens if HDL is absent? Hypertriacylglycerolemia occurs. That means HDL is responsible for the removal of cholesterol, transportation of cholesterol. If its deficiency occur, it would lead to the increase in level of cholesterol, and which would cause atherosclerosis in elder person. Other similar disorders are also there, like Tangier disease, Fisheye disease, ApoA1 deficiency, which occurs due to the different defective segments of lipoproteins. And there is also a familial lipoprotein lipase deficiency type 1. If this lipase get deficient, then there would occur hypertriacylglycerolemia, which would lead to the accumulation of abnormal LPL lipoprotein or ApoC second deficiency, causing an active LPL. And the characteristics of this disorder is slow clearance of chylomicrons and VLDL, low level of LDL and HDL, no increased risk of coronary disease. But actually, here low level of HDL is beneficial for the body, and therefore coronary disease risk is lower in this situation. And another type is familial hypercholesterolemia, that is type 2A disorder, which occurs due to defective LDL receptors or mutation in these receptors. Okay, if these receptors get mutated, then LDL will not be transported, because they are always transported through receptor mediated endocytosis. Okay, I explained it earlier. So if LDL may not enter inside the cell, then their level elevated in the blood, and it would lead to the production of a situation. It would lead to a situation of hypercholesterolemia, resulting in atherosclerosis and coronary diseases. There is also a familial type 3rd hyperlipoproteinemia, where it is also known as broad beta disease, remnant removal disease, familial beta lipoproteinemia, familial hypertriacyl glycerolemia, or hepatic lipase deficiency disorder. Okay, here actually deficiency in remnant clearance by liver happens, and which is occur due to the abnormality in ApoE. ApoE is a part of remnant chylomicrons or VLDL. So remnant chylomicrons or VLDL level increases inside the body, which would lead to the hypercholesterolemia, xanthomas, and atherosclerosis. In type 4 familiar hypertriacylglycerolemia, actually overproduction of VLDL occurs, which often associated with the glucose intolerance and hyperinsulinemia. If VLDL overproduce, then the level of cholesterol ultimately go high. VLDL and LDL and HDL level become abnormal, and it will actually it is associated with alcoholism and diabetes mellitus and obesity. Hepatic lipase deficiency basically occur due to the deficiency of hepatic lipase enzyme, and this would lead to the accumulation of larger triacylglycerol rich HDL and VLDL remnants. Patients who suffered with the hepatic lipase deficiency have xanthomas and coronary heart disease. Coming to the atherosclerosis, we have already learned a lot about the atherosclerosis and deposition of cholesterol in the heart arteries. If you have if you want to learn further about this topic, you can go to these links, or you can also read a hardcore medical biochemistry book. Thank you so much for today's class, and if you people have any question, you can ask.